Hi, in this video you will learn how you can get rid of internal hemorrhoids, tips, cures and treatments. If you liked the video, hit the like button and subscribe for new videos that will be released. Internal hemorrhoids are on the inside lining of the rectum and are not visibly seen by the eye unless they are enlarged, and then they can be felt too. Internal hemorrhoids are usually painless and get noticed when causing rectal bleeding with a bowel movement. The easiest and fastest way to get rid of internal hemorrhoids is changing your lifestyle and eating habits, using stool softeners if you are constipated, using the squatting method and not straining on the toilet or sit too long. Some complex cases of hemorrhoids may need surgery to treat them, but most cases can be cured by following only some home procedures, including use of the sitz bath. It is a dedicated plunge pool designed to facilitate exposing the anal area to warm water. Use over-the-counter ointments and creams, which contain substances that help relieve pain and itching without any side effects. Applying cold compresses or ice to the swollen area several times a day. Avoid scratching the area, as you may scratch the area, which can irritate it, making the matter worse. Wearing loose, soft, and cotton underwear, to keep the anal region dry and free of moisture that can complicate hemorrhoids. Avoid using harsh toilet wipes, and use alcohol-free moisturizing wipes. Sitting in a squatting position, when going to the toilet. How to cure internal hemorrhoids? For cure and avoidance of internal hemorrhoids, it is advised to increase the amount of water that a person drinks daily, because it helps to make the consistency of the stool a smoother and easier effect on the abscess, and it is also advised to exercise regularly and avoid sitting for long periods, especially on hard surfaces such as concrete or tiles, and it is also recommended to eat foods that it contains a high proportion of dietary fibers such as flour, pears, and carrots. What causes internal hemorrhoids? Any disease or health condition that increases pressure on the muscular walls of the anus and rectum can lead to swelling of the anal blood vessels and the appearance of hemorrhoids, and here are some of these reasons. Pregnancy. Hemorrhoids occur more commonly in pregnant women, because the larger the uterus, the greater the pressure on the colon and its parts, thus symptoms such as constipation and hemorrhoids appear. Aging. The adults over the age of 45 are the most vulnerable to hemorrhoids, however, this does not mean that young adults and children cannot develop hemorrhoids. Diarrhea. Hemorrhoids can occur in cases of chronic diarrhea due to the exposure of the anus and rectum to continuous pressure to pass. Chronic constipation. In cases of chronic constipation, the pressure that the patient is trying to create on the intestine causes the excretion to create additional pressure on the walls of the blood vessels. Lifting heavy objects. Repeated lifting of heavy objects can cause hemorrhoids. Anal intercourse. Anal intercourse exposes anal and rectal intercourse to great and abnormal pressure, so one of the inevitable consequences is the appearance of hemorrhoids. Obesity. Obesity puts more pressure on the gut and intestine, so it can cause hemorrhoids. Heredity. Some individuals are more likely to have hemorrhoids for genetic and hereditary reasons. Symptoms of prolapsed internal hemorrhoids. Some people have prolapsed hemorrhoids, and this type of hemorrhoid is more painful than internal hemorrhoids. In other words, prolapsed hemorrhoids are one of the complications associated with internal hemorrhoids of the 4th or 3rd degree. Prolapsed hemorrhoids appear when internal hemorrhoids swell and fall out of the anus, and prolapsed hemorrhoids look like bumps outside the anus. The symptoms of prolapsed hemorrhoids are bleeding. It is bright red and is associated with excretion itching. It is bothersome in the anal area. Feeling after complete removal. This is if the prolapsed hemorrhoid is large. Pain, especially during the removal and stretching process, thus increasing pressure on hemorrhoids. If you suffer from severe pain and bleeding from the rectal area, and if it is accompanied by abdominal pain, diarrhea, or a high body temperature, it is important to consult a doctor immediately. Treating prolapsed hemorrhoids. In most cases, it is possible to reduce the size of the prolapsed hemorrhoid through some natural remedial interventions at home, and the most important of these treatments are: pressure by a cold source on the area. Soak the area with warm water. Use over-the-counter medications after consulting your doctor. Avoid straining during bowel movements. Eat a healthy, balanced diet that contains dietary fiber, to avoid constipation as much as possible. Drink enough water daily. If these home remedies are not successful, it is important to consult a doctor, who will determine the most appropriate treatment for you based on your medical history and the severity of symptoms. How long do hemorrhoids take to heal? Some individuals may have medications or medical procedures to reduce their symptoms and shrink hemorrhoids. There is no set length for hemorrhoids. You will get rid of small hemorrhoids without treatment in a few days. If hemorrhoids do not heal within a week, it is best to envision a doctor for treatment. Small hemorrhoids usually disappear within a couple of days on their own, except for many people, as hemorrhoids remain for a long time, especially if the patient was 50 years earlier. But if treatment was received from the start of the disease's invention, the patient could tolerate it within months. Do not be surprised if you recover completely, and you usually have hemorrhoids again, as this is normal, as it always happens. Recovery time for internal hemorrhoids are usually 10 to 14 days. Although people's healthy recovery times vary, many people can recover their health in 10 to 14 days. Complications are rare, but please refer to the doctor if you have a fever, cannot pass urine, pain during urination, feeling dizzy. The duration of treatment for external hemorrhoids depends on several factors related to the severity of the injury, the age of the patient, and other factors that affect the speed of healing. Hence, it can be said that the duration of treatment for internal hemorrhoids can be lengthened or shortened according to the extent of the patient's commitment to treatment and the manner of using medicines and herbs correctly without excessive adherence to a diet that guarantees him protection from constipation to prevent complications that may delay. What are hemorrhoids? Hemorrhoids are swollen veins in the lower part of the anus, which are swellings that occur in the venous network of blood vessels in the anal region. Internal hemorrhoids are far enough inside the anus and cannot be seen or felt usually, and their cause is the emergence and prolapse of the veins at the beginning of the rectum to the outside in the anal canal. Bleeding hemorrhoids. Bleeding may be the only sign of it, and this article will present the causes of internal hemorrhoids, their symptoms, cure, causes, and prevention. The most important symptoms of internal hemorrhoids appear when you see drops or intermittent red blood points when you have a bowel movement. The problem here is that blood appears most often without the patient feeling pain. How to know you have internal hemorrhoids? For that reason, patients with internal hemorrhoids recognize their disease late in the infection so that the hemorrhoids are filled with blood and a clot, or in some cases of internal hemorrhoids when the hemorrhoids are close to the anus. As for clots, their shapes and sizes differ from person to person according to his condition, only the size of a pea or nut. In all cases, this clot can be defined as a blue lump around the anus, and this clot quickly dissolves within 7 days, forming a small, empty skin sac, and then the pain will disappear. Thanks for watching. If you found the video, press the like button and subscribe to the channel for new videos.